Welcome everyone. This is a recorded session and today we have Nicole with us. Nicole, why don't you introduce yourself?
Hi, I'm Nicole Gibson from Occupational Care Services, and we are here to review the procedures in fit testing for respirator usage to make sure our workers stay healthy.
Excellent. So today, this is my first time getting fit tested, so I have never experienced a fit test before. So
Okay.
I'm excited to learn. You're going to have to tell me all about this.
Sure. So what we're going to do is we're going to fit you with a half-face mask today. There's multiple kinds of respirators in the industry, anywhere from full face to N95s, which a lot of people are more familiar with nowadays, and then obviously your half face. So we're going to fit you with the half face. I noticed that you're wearing glasses. Do you wear glasses all the time?
I do, yes.
Okay.
I can't see without glasses.
Okay. So if you were to need a full face for your type of position or your job or your industry, then you could be fitted for a full face, but you would just need to have what's called a spectacle kit. And a spectacle kit goes right inside the full face mask with your lenses so that you are able to wear a full face mask so that people that have glasses don't have to not have that choice. So, but in this situation, we're going to go ahead and fit you with a half-face mask, so you're absolutely welcome to keep your glasses on.
Okay.
One of the things that's most important about fit testing, obviously, is the health clearance. So you would have needed to done the OSHA health questionnaire. Depending on which respirator you're using, you could have to do questionnaire part A and B or one or the other.
Okay.
Once that questionnaire is reviewed by the physician or licensed healthcare provider, you would then get a clearance for fit testing usage, and then obviously you would also have to have that coincide with your past successful fit test in order to be safe in the workforce. Okay?
Awesome.
All right.
Sounds good.
So what we're going to do today is we're going to do what's called the quantitative fit test. The quantitative fit test is an objective fit test, and it gives us scientific leak rates and fit factors. So it lets us know that when we're putting this mask on you, this is absolutely going to keep you safe based on the fit factor for your industry, and that there's no leaks or anything like that. Perfect. There's also a fit test called a qualitative fit test, which is a hood type test that goes over your head, and then there's some solution that's sprayed around the mask, and basically subjectively we ask you to do a few things and if you can smell it or not.
Okay.
However, obviously for industrial purposes and also half and full face masks, the quantitative fit test is the best way to go.
Perfect.
Okay?
I'm excited to learn about this. So.
All right, so with that being said, we'll get started. I'm going to go ahead and start you out with the large size respirator first, and we'll see how that does.
Okay.
Now, with a respirator, you just want to put this up over your head. This should actually fit on the top part of your head, and this actually sets on the back.
Okay.
And then what you're going to do is you're going to buckle these two straps in the back.
Okay.
And then on the front of your respirator, you have fits areas where you can pull these straps to adjust them.
Okay.
It's very important to kind of pull them equally so that you get a good feel.
Okay.
And then once you have this on, we're going to go ahead and do a little prop opening for the valve so that when we hook you up with the adapters, you'll be ready to go. Now, there's different types of adapters that fit different types of masks, and so we have to make sure that we use the proper adapter so that we can get the proper score that matches that test. So it's going to feel a little bit strange because of the adapters, but just go ahead and throw that on.
Excellent.
This goes right around?
Yes, you're doing great.
Perfect.
Doing great.
I'm just going to
Yep.
try and feel what I'm doing here.
Yep. It takes a minute just to get used to it a little bit.
Okay. There we go.
Good. So you want to just make sure that you take your glasses and pull them up a little. There you go. Just so that they're not interfering with the seal. Make sure they're comfortably on your face. Good. How does that feel for you?
That feels quite tight, actually.
Okay.
Yep.
So you always want a respirator to be snug fitting, not too tight, because too tight can cause a leak as well.
Sure.
So as long as that feels good, can you just lift your head up for me? Okay, good. And then you're going to go ahead and you might hear like some whispering sounds. That's because of the adapters, and we have the valve propped open because this is a controlled negative pressure test.
Okay.
So everything looks good. No, doesn't feel like it needs to be tight or anything. You feel good?
No, that feels really good.
Perfect. So what we're gonna do is I'm gonna go ahead and hook you up to the hoses here.
Okay.
And then we're gonna go ahead through a series of exercises.
Okay.
And all you're gonna have to do during that is hold your breath while I hold the button down, and then
Okay.
you'll release your breath.
Perfect.
So it's a fairly easy test, and this particular machine does quantitative testing. The controlled negative pressure test is actually a lot nicer for the person doing the respirator testing because
Awesome.
it's much quicker than the ambient alcohol ones.
Sure.
So we can get you taken care of pretty quickly.
Cool.
Okay, so we're gonna go ahead and just click the start button. And so all you need to do is just look straight ahead at me
Okay.
and just go ahead and when you're ready, hold your breath. Don't breathe, don't move, just stay nice and still whenever you're ready. Okay. Okay, go ahead and breathe. Now, the screen, as you can see, it gave me, when it was going through the graphs,
Okay.
it gave me, it didn't give me a nice flat line is what we were looking for,
Okay.
which would give us our fit factor. And you can see also, too, with the data, it says fit factor is a fail. Okay? And it's very possible, and more than likely, this is the situation, that there's definitely maybe some interference with the glasses, but probably your facial hair stubble is what's
Okay.
causing it.
Okay.
And that's what's super important to understand about fit testing is because even just the tiniest little bit of something that's going to break that seal will cause, obviously, you know, some hazardous chemicals or something like that you're trying to keep out to seep in. We don't want that to happen.
Sure.
Right?
Sure.
So we're going to try one more time. I just want you to go ahead and hold your breath and don't breathe. Okay, good. Doing really well. Doing really well. Okay, and breathe. Okay. So now this one here I wanted to show you, this one was actually aborted
Okay.
because I actually let go of the button before you were done breathing or
Okay.
before you
Before I
stopped the
stopped.
test. But the nice thing about it is that we did start to get a nice flat line, so it's possible that as the seal is actually starting to seal to your face, we are starting to get a seal, which is why it's important to go through all the exercises before you just tell someone, you know, this isn't the right fit for you.
Sure.
A lot of times you can tell in the industry if something's too big or too small right away on someone's face, and then obviously you can adjust accordingly.
Sure.
All right, so we're going to go ahead and we're going to try that again. Hold your breath. Okay, doing good, doing good, doing good. Stay just like that. Almost done. Couple more seconds. And breathe. Good. Now you can see we have a nice pass rate. Did you see that fit
I
factor
did.
was
I did.
5847. That's a great fit factor. Typically a half face or a full face mask, you could tell when we started up, needs a fit factor of 500. So to get your first score at 5847 should give you a pretty comfortable feeling knowing that this is a really good fit for you at this point.
That's
Okay?
awesome. Very
And then the
good.
next exercise you can see wants you to bend at the waist.
Okay.
One of the things that happens during this fit test is that when we start to go through motions, we go through motions as if you were out in the job force. If a seal were to break, if you're moving, lifting heavy equipment, all over the, you know, different things like that. Okay, so go ahead and bend over at the waist and then just hold your breath, please. Good, stay just like that. Doing good, doing good. Perfect. Okay, and you can see we have a fit factor of 4846 on that.
Nice.
That's even great. That's even better, right? So
Cool.
far so good. So now this one here, this one wants you to shake your head, right?
Okay.
So again, we're recreating normal movements throughout the day, right? So you're
Yeah.
just gonna shake your head,
Okay.
okay? And then just go ahead and hold your breath. Okay. Okay, and hold still. Good. Okay. So again, even with the shaking of the head, we
Yeah.
got our fit factor of 4106, which means that's a really good thing because that means as you're
Yeah.
moving around like that, the seal is staying where it needs to be,
That's
right?
awesome. Awesome.
Okay. So this next one here, we want you just to go ahead and remove the mask, and then
Okay.
we're going to re-don it, and we want to see
Okay.
what happens in that situation. Obviously, throughout the day, people are going to be taking their respirators on and off.
Sure. Sure.
Breaks, things like that. So we want to make sure that when they put them back on, that obviously the situation goes back to the exact fit test that we had before.
Sure. crackling.
The little buckle, yeah.
Ah, there we go. There we go.
Perfect. Does it feel like it
Yep.
did before you took it
it
off?
does, yeah.
Excellent.
Maybe just, yeah, there.
Okay.
That's good.
Yep. All right. So now all you have to do again is just face me and
Okay.
just hold your breath.
Mm-hmm.
Okay. Good. Okay, we're doing good. Doing good. A few more seconds. And breathe. Good. So we have a fit factor of 3842. Again, way above the 500 that we need.
Nice.
And so, you know, everything is doing really well with this. Okay, so again, it wants you to do another read-on protocol, so it wants you to take it off and on again. This also helps with the integrity of the mask to make sure that obviously when using it on and off, because obviously when you get your brand new mask, it comes nice out of the box and it's all perfect. So we want to obviously make sure that taking it on and off, everything still works well.
Okay. That feels better. Yep.
Perfect.
Cool.
All right, so we're going to go ahead and just hold your breath again when you're ready. Okay, doing well. A few more seconds. Perfect. Okay, and breathe. Okay, there you go. So 5274, and you can see we now have our overall fit factor. The testing is complete, and it gave us an overall fit factor of 4670. So now we know absolutely on your fit test record results and also your physician's written opinion of clearance, you're actually safe with this type of respirator. Now it's important to know that this respirator clearance is good for 1 year, and also if you have any changes in weight, or if you have any dental work, or maybe there's other things going on that could affect the structure of the mask, or you're getting a different type of respirator, even though the year is not up, you need to be fitted again, because it's very important that the fit test that you are cleared for, that is the respirator that you use. So the type of the mask, the model number, and the size will be incorporated on the OSHA paperwork.
That
Okay.
is cool.
You're welcome to go ahead and take that off. Okay. And
Wow.
yes. It can be a little bit warm sometimes under there. I know. So, and then this would be your respirator to keep, and again, this would be the respirator that you would need to use every day. Do you have
Perfect.
any questions or concerns that I can help with?
That is interesting. And wow, fit testing's interesting, isn't it?
It is.
But you can see how important that fit to your face is to get that good seal.
Very much. It's very, and absolutely 100% the quantitative test for half or full face respirators is absolutely the industrial gold standard, because again, you want to make sure if you're an asbestos worker or a silica worker, you know, in laboratories, anything that you could potentially be exposed to, it's very important that not only does the fit test work, but you're using the proper respirator and also cartridge that actually would go with the respirator. So very, very important.
That's excellent. And you talked at the start about, obviously, you know, I've got a little bit of stubble there.
Right.
We managed to get that to pass.
We did.
Technically, I should have probably shaven that
We
off, been
did,
clean
yes.
shaven.
So the requirement for fit testing is clean shaven, but you can also go on OSHA.gov to actually see facial hair for respirator use. For example, if you had a full face respirator, you'll see on the OSHA.gov website that it will actually allow you to have like a mustache or some sort of thing like that.
As long as it's not interfering with that
correct.
seal.
Your stubble is very, very fine. So that is the reason, obviously, we got our fit factor approved. But initially, you could see as it started out, it wasn't quite working. But obviously, when the skin started to adhere to the seal of the mask, we were good to go. However, clean shaven absolutely needs to be how the fit test done.
Yeah.
If you were to go probably another 3 hours with your facial hair, then it would not work. So you would know that that absolutely needs to come off when you wear that respirator every day.
That's interesting you say that, because they're obviously, you know, I shaved 3 weeks ago, and for some people, facial hair can grow pretty quick, right?
Correct, yes.
So even during the course of a day, just that simple growth in facial hair could even be enough to
Absolutely.
cause that seal to break.
Absolutely. I have several people in my family that obviously will be clean shaven in the morning, and within a couple hours they have, you know, that facial hair, and that absolutely can change the fit and the factor of your respirator, which could cause some health issues for sure.
That's excellent. And before we came on the video here, I think we were talking a little bit about even some of the other reasons why people may not be able to wear this type of negative pressure respirator, whether it's a pulmonary function test or whatever that may be.
Absolutely. So once the healthcare is or the questionnaire is reviewed, depending on the answers to that health questionnaire and review by the physician or licensed healthcare professional, there may be additional testing that is required for the individual to make sure that they're not going to have any issues wearing a restrictive type of respirator that could cause breathing problems or something like that. So you want to make sure if people have, you know, asthma and things like that, that they do have the pulmonary function test, and that obviously is cleared as well. So depending on that questionnaire review, which is critical, it's very important to obviously make sure that that is followed. One of the really nice things that Occupational Care Services has is that we have an online questionnaire review. So it enables us to be allowed to move all over the United States to do respirator testing. We do on-site work anywhere. It's really nice. You can actually get the link to your phone. You click on it, you would answer your respirator questionnaire. It stays confidential between you and us, the healthcare provider. The employer does not get it, and it goes directly to our physicians, and then they review it, and then within a few moments, you'll know whether or not you're cleared for a respirator fit. Remembering that the questionnaire is just a part of the whole situation that you need to get done, because obviously the fit test needs to be done as well. Anytime you're wearing a respirator, you must have a fit test performed, and anytime you have a fit test performed or you're doing anything with respirator protection, you need to have the health clearance questionnaire taken care of and provide that clearance. It's very important.
Absolutely. No, that's excellent, and it's certainly exciting to meet someone else who's passionate about respiratory protection.
Yes, I'm super passionate about respiratory protection. I've been doing this for 27 years, and I just think it's very, very important that our workers come home to their families every day.
Absolutely. And protecting you for life's best moments is what we're all about here at RPB. So
excellent.
Definitely a huge shout out to Nicole and the team over there at Occupational Care Services.
Yes.
There we go. I got it all.
Yes. Yes. Occupational Care Services.